Alright, so right now I'm just verifying the MD order and the IV tube sizing, and everything matches up. So I'm going to go ahead and grab that. Knock, knock. Can I come in?
Yes.
Hi, my name is Savannah Isbell. I will be your nurse for the day. Before we get started, can I please have you verify your name and date of birth?
Debbie Isbell, 5/14/73.
Okay, and everything matches up perfectly. So before we get started, has your doctor explained the procedure to you already for the day?
Yes.
Okay, so perfect. So it is just a routine procedure, a simple blood transfusion. Some common side effects, however, are fever, itchiness, shortness of breath. You can even just have a sense of uneasiness. So due to that, I'm going to stay in here with you about 15 to 30 minutes after we do the transfusion to make sure everything is okay and just monitor your vitals. How's that sound?
Perfect.
Okay, so speaking of vitals, I'm going to go ahead and get your baseline vital signs so we have something to compare to later. So I'm going to take all her vital signs and do all that. So once I document vital signs, I'm going to go have my other nurse come in and double check the blood with me. So come on in. Okay, so right now we are going to check the patient name, ID badge, blood group, and RH type. And then both of us are going to confirm the donor blood group and RH type, cross-match compatibility, blood unit number, the expiration date and time on the blood product to the MD order, as well as the presence of the blood if there's any clotting or discoloration. So thank you for checking that with me and have a good day. Okay, so now I'm just going to encourage my patient. Do you have to use the restroom
No.
before we go? Okay, when was the last time you used the restroom?
An hour ago.
Okay, so that sounds good. So I'm going to go ahead and go wash my hands, and when I come right back over here, we'll get started. How's that sound? Perfect. Alright, so now I'm going to wash my hands and don clean gloves. And then I'm going to come in here, take my tubing. I'm going to spike the normal saline, making sure all of the clamps are closed. So I'm going to spike this, and I'm going to open this clamp until about half of this is filled. And then I'm going to close the clamp, about 500 ml of normal saline. And then once everything's done, I'm going to open this to prime the tubing. Once it's primed, I'm going to close it. And then I'm going to spike, once these are both closed, now I'm going to spike the blood and open this and let the blood go through. Make sure this is closed. And then once it's all through, I can open this. And then right now I'm going to verify again the blood order and check with the patient. And then I can administer. And then once this is administered, I'm going to wait with the patient 15 to 30 minutes after, monitoring vital signs every 5 minutes, and then monitoring vital signs every 15 minutes the next hour, and every hour after that until the blood transfusion is complete. So then I am going to wash my hands per CDC guidelines and make sure the patient, do you need anything before I head out?
No, I'm good.
Perfect, thank you, have a good day. And then I'm going to leave, document the procedure, and that's it.